Hey, I'm Dr. Jesse Greer, founder of Preamble. As an internal medicine physician and former Special Forces doctor, I saw the same things at both ends of the spectrum. Bodies breaking down and a healthcare system too late to help. That's why we built Preamble. Most of modern medicine waits until something goes wrong. You show up with symptoms, you get some labs, and if things are bad enough, you're given a diagnosis and a prescription. But that's damage control, not prevention. At Preamble, we don't wait for things to break. We identify risk early, measure what matters, and build personalized strategies to extend performance and prevent decline before symptoms ever show up. We focus on prevention, performance, and extending not just lifespan, but health span, the number of years you're actually living well. Most people live into their 80s and 90s, but their health span ends in their 60s. That 20 to 30 year gap, that's what we're here to close. One of the most valuable tools we use at Preamble is the DEXA Scan. This machine gives us a highly accurate, incredibly detailed look at three major areas: muscle mass, bone density, and body fat distribution, including visceral fat, which plays a massive role in disease risk. So let's break that down. First, muscle mass. We lose muscle, slowly at first, then rapidly as we age. Most people lose 3 to 8% of their muscle every decade after 30. And strength is everything when it comes to aging well. Muscle is protective. It's metabolic. It helps keep you mobile, functional, and independent. DEXA helps us quantify exactly how much lean mass you have and where. Are you carrying enough in your legs and hips? Are you imbalanced left to right? It lets us identify risk early and build strength strategically. Second, bone density. Weak bones lead to fractures, and hip fractures, for example, are often a turning point in someone's life. Mobility drops, complications rise. With DEXA, we can catch bone loss early, intervene with the right training, nutrition, and medications, and avoid these downward spirals. Third, fat distribution. Not all fat is the same. DEXA shows us where you store it. Subcutaneous versus visceral fat. Android or abdominal versus gynoid in the hips and thighs. Visceral fat is especially dangerous, linked to inflammation, insulin resistance, and cardiovascular risk. And you can't guess it based on body weight alone. Two people can weigh the same, but have completely different metabolic profiles. With DEXA, we can see those differences and track them over time. That's a key point. This isn't a one and done test. When we repeat it, we can measure real change: fat loss, muscle gain, improved ratios, shifts due to nutrition, strength training, cardio, even medications like GLP-1s or hormone therapy. Maybe the number on the scale hasn't moved, but your body composition has changed dramatically. That's where the DEXA shines. It tells the truth underneath the weight. It's also essential for understanding how lifestyle changes are working. Whether the goal is fat loss, longevity, injury recovery, or athletic performance, DEXA gives us a precise map of where you are and where you're headed. Now, when we combine DEXA with other testing we do here, it becomes truly powerful. We run cardiopulmonary exercise testing, or VO2 max, to find your precise heart rate zones for training. We test your resting metabolic rate so we know exactly how many calories you burn at rest. We assess strength, power, and mobility to highlight your physical blind spots. We layer in continuous glucose monitoring, advanced blood work, and full risk profiling. And now we've got a 360-degree view of your health. This isn't just for elite athletes. In fact, it's most powerful for the amateur athlete, the weekend warrior, the busy parent trying to age well and stay in the game. From that data, we build highly targeted lifestyle plans supported by physicians, nutritionists, physical therapists, mental health experts, and more. This is how real prevention is done. This is how we train for health span. This is Preamble.